My name is Morris Kent Thompson, and I'm testing the waters to run for President of the United States. My website is www.mktlistings.com. On healthcare, one of my campaign positions while running for the United States Congress in the 2000 election dealt with healthcare and met with great discourse and attempts to silence the messenger. Specifically, in the late 1980s, when the insurance companies were selling the HMO concept to the doctors, I was asked by a friend of mine, a teaching professor with his own practice, to accompany him to the dinner. The insurance company's main selling point was that the HMO concept was a mechanism to insure and target the lower income. Quite simply, that under this concept, the doctor, the hospital, and the nursing home would receive an allocation of 21 cents on the dollar and monthly capitation of $10 per patient. The insurance company went on to say that no self-respecting employer would force this on their employees. This leaves one to question, are there any self-respecting employers? And more importantly, where's the other 79 cents? Someone in the insurance industry had used a theory called the contribution margin approach to pricing. This methodology allows business to set pricing in the short term to facilitate additional revenue by reducing the price when fixed costs have been met. In theory, this is a very beneficial approach that allows business to maximize its short-term revenue and profit. The concept is not designed for a long-term cure-all, as all costs in the long term are variable. To the average person, this concept is confusing and misunderstood, and was a major contributory cause of the healthcare crisis. Business made a good faith effort to make this plan work, with companies like PhiMatrix and CareMatrix, who bought up thousands of medical practices throughout the Southeast United States. As the concept by design was a break-even situation at best, these companies failed and went bankrupt. Yet neither the government nor business sought to reassess the allocation base, instead opting to use a financial model that by design was flawed. Universal health care is achievable. We must first ensure the financial model is credible, that the marginal revenue and marginal cost is accurate, so that we may determine any real shortfall. Moreover, we must ensure a diverse base, not based upon company size or single payer, but use the entire country as the model. This will ensure economies of scale and that no individual will be penalized for not being with a large company. We must look at other programs like workmen's compensation and others and combine and eliminate these programs into a universal health care program, which will further increase economies of scale and reduce the cost. Technology can and will play a role in delivering universal health care, as the World Wide Web is a universal platform that can reduce the need for bricks and mortar, facilities, overhead, etc., and significantly reduce the cost associated with customer service. A reasonable overhead cost would be in the 3 to 5% range, not the present 79% the HMOs are reaping. These factors and many others play into determining the true marginal revenue and marginal cost, which will help to determine any shortfall and what cost is to be borne by the employer, the insured, and the government to achieve the desired result. Universal health care for all Americans that is affordable, with a single payer concept that provides the customer, you, the right to select the doctor or hospital of your choice. This keeps competition alive and does not allow the government to dictate your coverage, or most importantly, who your doctor will be. I envision universal health care policy where the individual will have a deductible of no more than $500 per family, and based upon their ability to pay, with the government making up any shortfall. The system will use the World Wide Web as a universal platform to provide cost-effective customer service and hold down any unnecessary overhead, such as bricks and mortar costs, commissions, administrative salaries, etc. That is why it is so important to determine the real marginal revenue and marginal cost, net of combining other programs that are in reality insurance. The end result is that the individual, you, will only know that they have the finest health care in the world at an affordable cost. Put me on the ballot in all 50 states, and together we will straighten out this mess. My name is Morris Kent Thompson, and I approve this message.